Skyrocketing medical bills, high insurance premiums and deductibles. It's a prescription for worry and fear.
So Call for Action's Keith King shows how a little homework can save you a lot of money on health care. Keith?
Mark and Krista, good evening. If you go to the doctor for more than just your annual checkup, chances are it will cost you. As you're about to see, there are big differences in what you pay depending on where you go. With 3 kids and a high insurance deductible, Dana and Michael Harding know bills for a sick child can quickly add up.
You start having a savings for your personal life, you never anticipate that one of your children is going to become very ill.
That's what happened last year. Their 12-year-old son, Sam, contracted strep and came down with a rare autoimmune disease that their insurance didn't cover. Expensive blood tests and trip to specialists quickly added up to tens of thousands of dollars.
It's horrible because you're already dealing with this, the concern of your son, and then you have the medical bills on top of it, and it's overwhelming.
5 years ago, people maybe had a $250 deductible. They paid a $10 or $20 copayment.
Jane Cooper is CEO of Patient Care, a health research company.
Because costs have escalated so rapidly, there is, as you said, more of a cost sharing with the employee through higher deductibles.
Companies hire Cooper to research the price of medical procedures at different facilities in their city. She price shops to help people save money.
The impact for employees is, wow, now this is my money that I'm spending, and I do want to understand how I'm spending it.
Cooper shared with us price comparisons for different procedures around Kansas City. A patient's out-of-pocket cost for a mammogram, $267 at a local hospital, but $142 at an imaging center. That's $125 less. And ultrasound. Cooper found prices ranging from $100 to nearly $400. And a thyroidectomy, $1,500 to $2,500, a $1,000 price difference for the patient.
Whether I go to an imaging center, outpatient imaging center, an inpatient hospital, an academic medical center, the costs are very different.
When it comes to elective procedures, patients often go where their doctor suggests.
As a patient, I would be asking questions. Can I go somewhere else? Is there a way for me to go to an outpatient facility?
Places like Diagnostic Imaging Centers, which does everything from mammograms to MRIs, is not tied to a hospital. That can mean less overhead and less cost to the patient.
As consumers, we tend to shop around for most things. When you're looking at your health care needs, which are probably the most important consumable service that you can buy, I don't see why we would not choose to educate ourselves.
Today, the Hardings go to a cash-only doctor who offers low prices because insurance companies aren't in the mix. The Hardings use the family plan. $100 a month gets them unlimited office visits.
I don't have to worry about my insurance denying the claim or, not covering it for some reason. It's covered, so I've already paid for it.
Saving them money and worry. And I will have more on the cash-only doctor tomorrow night. I recently learned the hard way that it really does pay to shop around. I needed an MRI for my hand. I went to where my doctor recommended, a local hospital. My out-of-pocket cost $1,300. Since then, I checked around. I found a local imaging center in town that would have only charged me $500.
Oh.
$800 less than what I ended up paying out of pocket. So,
I'm so intrigued by the cash-only docs tomorrow at 5 on that.
Tomorrow at 5, absolutely.
And then as patients, what do we need to do?
We need to ask a lot of questions. First of all, ask your doctor questions. If they recommend that you go to a particular place, find out why they're recommending it. Find out how much it's going to cost you, or is there a cheaper place you could go. Also, call your insurance provider. Ask them to recommend some facility in town that will end up saving you money. And finally, last resort, simply pick up the phone and call some centers yourself just to do a little price checking. It's complicated. It can be very frustrating, but still, you can be armed with a little bit of information to help you do some price comparisons.
Yeah, whole different world.
Whole different world with the HSAs now.
Absolutely.
Thanks, Keith.
Sure.